Why is osteoporosis diagnosis so important? Imagine a disease that quietly weakens your bones without any warning signs until a sudden fracture occurs. That's what makes diagnosing osteoporosis so crucial. It's often called a silent disease because many people don't realize they have it until they suffer a fracture, which can be life-changing. Early diagnosis helps identify those at increased risk so they can take steps to prevent serious injuries. The main reason to diagnose osteoporosis is to assess fracture risk. Bones become fragile when osteoporosis develops, especially in areas like the hips, spine, wrists, and pelvis. Healthcare providers usually use a test called bone mineral density measurement, often done with dual-energy X-ray absorptiometry or DEXA. This test compares your bone density to that of a healthy young adult, giving a T-score. A score of -2.5 or lower indicates osteoporosis. Knowing this helps doctors understand how likely you are to break a bone in the future, even if you haven't had any fractures yet. Diagnosis also guides treatment decisions. Once osteoporosis is confirmed, your healthcare provider can recommend medications approved for strengthening bones and reducing fracture risk. They might also suggest lifestyle changes like eating a balanced diet rich in calcium and vitamin D, engaging in weight-bearing exercises, and making your home safer to prevent falls. Without a diagnosis, you might miss out on these important interventions that can help you maintain your independence and quality of life. Getting a clear diagnosis improves communication between you and your healthcare team. It creates a shared understanding of your bone health status, making it easier to plan ongoing care. It also helps with insurance coverage, ensuring you get the necessary tests and treatments without unnecessary delays. When everyone is on the same page, managing osteoporosis becomes more effective. Screening and diagnosis are especially important for those at higher risk. This includes postmenopausal women over 65, men over 70, or younger people with risk factors like a family history of osteoporosis, smoking, or certain medical conditions. Early diagnosis in these groups can prevent fractures that often lead to pain, disability, and loss of independence. It can also reduce the risk of death associated with serious fractures, especially hip fractures. Diagnosis isn't just about bone density scores. It also considers other risk factors and fracture history. Tools like the Fracture Risk Assessment tool combine bone density with age, gender, medical history, and lifestyle factors to give a more personalized risk estimate. This helps doctors tailor treatment plans to each individual's needs. Finally, diagnosing osteoporosis early can prevent the serious health consequences that come with fractures. Hip and vertebral fractures can cause chronic pain, mobility issues, and increased dependence on others. They can even increase the risk of death, especially in older adults. By catching osteoporosis early through proper screening and diagnosis, healthcare providers can implement strategies to strengthen bones and prevent these life-altering outcomes. In summary, diagnosing osteoporosis is essential because it uncovers a silent but serious disease before fractures happen. It guides effective treatment, supports coordinated care, and helps prevent the pain, disability, and increased mortality associated with fractures. Using standardized criteria like bone density testing and fracture history, aligned with medical guidelines, ensures accurate identification and appropriate management. Remember, always consult healthcare professionals for personalized advice and care.